Cryo-Medica is innovating the precision-based focal treatment of prostate and kidney disease, utilizing a clinically proven technology that has been optimized to not only provide the patient a best-in-class treatment, but also provides the physician the ultimate flexibility when it comes to how and where the treatment will be conducted. And for the first time in many years, also provides financial value with the highest profit potential compared to the existing options. Cryo-Medica has designed the lightest, most compact, and easiest to use cryoablation technology that will allow focal cryoablation, that is, the destruction of a precisely selected area of tissue using ice delivered by an advanced system of sterile probes to be used in the hospital, ambulatory surgical center, or in the case of prostate cancer, even the physician's office. With the average focal cryo-prostate treatment taking approximately 45 minutes to 1 hour, it is very feasible that the physician could treat 8 patients in his office per day and increase his reimbursement by 400% per patient. For those physicians employed by the hospital and having to perform their procedures in the hospital OR, the Cryo-Medica system can increase per case profit by 200%. All without sacrificing the quality of focal therapy. The Cryo-Medica system has been designed by one of the most recognized names in the industry, and arguably one of the most clinically published urologists on the topic of destruction of diseased tissue using ice. The executive team at Cryo-Medica was responsible for the evolution of focal therapy within urology and brings over 20 plus years of product innovation and commercialization expertise in this very specific field to the company. With over 15 years of clinical data, we know that the precise destruction of diseased tissue using cryotherapy can lead to cancer control as good as or better than radical prostatectomy or radiation for prostate cancer, and for kidney cancer, disease control as good as with laparoscopic removal of the kidney. The 10-plus year clinical data also strongly supports that focal cryoablation can achieve cancer control with less side effects than surgery or radiation. In this asset-light environment where capital equipment purchases are scrutinized more and more, and where the cost of sterile disposables to conduct ablation procedures are making focal therapy programs unviable, the Cryo-Medica console and series of probes have been uniquely designed to allow manufacturing at a fraction of the cost of our competitors, maximizing shareholder value, and once again making focal therapy a viable option for hospitals and physician practices alike. Finally, a technology innovation that is in line with an approach that has more than 10 years of clinical data, significant patient demand, an established and healthy reimbursement, and value like no other competitive system on the market today. Now, all we need is your financial support during this $4 million raise that will get us to FDA submission. The $4 million is being raised via a simple agreement for future equity, a SAFE agreement, with a 10% discount and a $25 million post-money cap. Join us as we usher in a new era for focal therapy.